Speaking during a stakeholders meeting in Lagos, the Minister of State for Health, Lasg, intimates that the federal government is ready to partner the private sector through the creation of a platform that can tackle the problem on a broad basis. He further explains that the primary healthcare system initiated by the federal government will help reach the grassroots in Nigeria.
Well, we promised them that we are going to make use of their expertise, of their efficiency, and of their management skills, and also a lot of them have a lot of experience with distribution, and give them a full partnership in the management of all programs in which private sector is working with government. First of all, working on the primary healthcare system to build up the national health system, and part of it is based on the National Health Act and the Basic Healthcare Provision Fund, which is to facilitate setting up healthcare down to the grassroots.
For the speaker, the fight against malaria is one that should involve all stakeholders through investment in human resources.
Within the country, within the community, and within the workforce. So, in reality, malaria becomes a business issue and a business cost. So it is a business driver, it is a business interest for companies to invest in malaria, because through investment they are improving or decreasing the absenteeism within their workforce, which then translates into productivity, which in the long term translates into economic growth.
Also stressing the need to combat malaria to zero is this private operator, who says the role on non-governmental organizations and the private sector is vital in addressing the scourge around Africa.
Data in 2016 about the number of deaths caused by malaria on an annual basis, we find out that there is a need for us to step up to fight against malaria. There is a need for the private sector to take charge, and there is a need for Africans to take charge of the issues that are facing Africa. And therefore, a group of private sector organizations together under the umbrella of the Corporate Alliance of Malaria in Africa.
With more private sector players coming on board and the government showing some level of responsiveness and openness to address a disease which kills more than the human immunodeficiency virus annually, an end to malaria might just be in sight.